Hello everyone, my name is Ariane Ortega, and for my presentation I'm going to be going over Glanz Chapter 8, titled Introduction to Models of Interpersonal Influences on Health Behavior. So the social cognitive theory describes that behavior is influenced by human behavior, personal cognitive factors, and environmental theories, and these factors interact continuously and they influence one another. The social cognitive theory moves away from the exclusion focus on one level or the other and has been one of the most influential theories in health behavior. There are also various key constructs and relationships among them. 3 that are worth noting are self-efficacy, collective efficacy, and observational learning. Self-efficacy is the confidence in one's ability to perform a behavior. Collective efficacy is group belief in achieving their shared goals. And observational learning is learning by watching others. And the major appeal of the concepts of self-efficacy and collective efficacy is that there are modifiable factors. It is interesting because observational learning has been part of a variety of disciplines, and it helps explain phenomena such as media violence, intervention skills to address substance abuse, as well as adapting new behaviors and skills. Models of social support and health. Holt, Lundstedt, and Proctor provided us with a clear conceptualization of social support, and they summarized the empirical evidence linking social support to good health. So we do want to make a clear distinction between the types of support, which are perceived support versus received support. Perceived support includes beliefs that help will be available when the individual needs it. This type of support is also strongly associated with better health outcomes. Received support, on the other hand, is the actual support that was provided. And the effects can vary depending on the recipient's needs and their perceptions. It's important to provide effective support as it can improve health and wellness. And then social supports can also help reduce loneliness. So improving social support interventions, some of the recommendations include focusing on what the recipients actually need, encourage individuals to communicate their preferred forms of support that they want, and involve the recipients into planning support programs. And then some of the benefits from this includes, increased effectiveness, greater acceptance to change and to support different behaviors, and then improve health outcomes. Social networks and health behaviors. So the social network theory examines relationships and social connections and how they influence behavior. Social networks affect health by shaping the social norms, influencing decisions and behaviors, spreading information, as well as spreading health messages amongst one another. So a few concepts here. One of them is homophily, which is people tend to associate with others who are similar to themselves, similar behavior, similar thought processes. It is more difficult to change behavior when individuals in a network are the same. So the concept here is friends influence friends. And another concept is information flow. Flow of information is another critical feature on networks. So health information is spread through networks and can influence behaviors such as vaccinations and disease prevention. And this is something that we saw during the COVID-19 pandemic, with the assumption that networks influence information sharing, whether accurate or not. Network norms influence adaptation of public health prevention behaviors, such as the vaccination. Stress, coping, adaptation, and health behaviors. So stress affects health via two pathways. The first pathway is behavioral, meaning coping behaviors, and physiological pathways that includes hormonal and biological responses. Chronic stress can lead to significant physical and physiological health problems. Research focuses on stress related to racism, discrimination, and social inequality. Other concepts include weathering, which is the accumulation of health effects of chronic social and economic adversity, particularly among African American women. African American women experience exclusion from social, political, and economic opportunities. So John Henryism is the idea of coping through persistent hard work and determination despite high stress that can lead to unhealthy outcomes. This type of coping can be protective. Other coping strategies such as mindfulness, spirituality, positive emotions, and social support may help reduce stress. And there's also this idea of superwoman's schema. This explains stress and coping among African American women. The superwoman schema is characterized by expectations to project strength, suppress emotions, and succeed despite the odds. High scores on the questionnaire items is associated with high stress. Future directions. In this section of the chapter, there are a number of recommendations and directions that the author believes we should continue to investigate. One of the points was determining which social support strategies work best in specific situations. Also understanding how race, ethnicity, class, gender, and social inequality affect health. It's also important to study health effects of online social networks and virtual support systems, and how those can impact individuals as well as different networks. Also developing interventions that strengthen health promoting social relationships. And one of the last points was exploring how information and communication technologies influence health behaviors. They also believe that by thoroughly understanding and appreciating issues at all levels will assist in developing more effective interventions and policies to enhance individuals and population health. So a little bit about my DMP project. It is on pressure injury prevention education program. The hope is to improve the knowledge gap among nursing staff and the knowledge concerning pressure injury prevention. I would also want to reduce the rates of pressure injuries in the hospital and improve the pressure injury bundle compliance. So the bundle compliance is all the interventions such as utilizing the wedges, utilizing heel protectors, and how to appropriately do a skin assessment, and pretty much all the interventions based on the Braden score scale. How my DMP project relates to the Institute of Medicine's recommendations outlined in the Crossing of the Quality Chasm, identifies the 6 aims for improving healthcare quality. The aim that I'm going to focus on is safety and the effectiveness of promoting evidence-based nursing interventions designed to reduce hospital-acquired pressure injuries while also improving staff's education on risk assessment, skin inspection, repositioning techniques, moisture management, nutrition, and support surface use. We want to provide nurses with safer and more effective care to vulnerable patients, so they'll have that knowledge to be able to do that. Also, reduce pressure injuries to decrease preventable harm, improve patient outcomes, and promote efficient use of healthcare resources. This project also aligns with the Healthy People 2020 because the Healthy People 2020 emphasizes improving healthcare quality and reducing preventable complications acquired during hospitalization. Although pressure injuries are not categorized as infections, they are recognized as a preventable adverse event and indicator of healthcare quality. So the educational intervention supports the objectives by enhancing healthcare provider knowledge, adherence to evidence-based prevention practices, and hopefully reducing the incidence of hospital-acquired pressure injuries and improving patient outcomes. I also want to focus a little bit on the social network theory. As I was describing it earlier, this is a theoretical framework that can guide this project. So the theory suggests that individuals acquire knowledge and modify behaviors through interactions with their peers, leaders, and professional networks. So in the clinical environment, nurses often learn and reinforce best practices through communication with their colleagues, educators, management, wound care specialists. So by incorporating this peer mentoring between wound care specialists and also doing some interdisciplinary collaboration, we're able to incorporate that into the education program. Evidence-based practices can be disseminated more effectively through the organization. These social influences encourage a more sustainable change in behavior, improve compliance with prevention protocols, and support the kind of like this change in culture focused on patient safety and the quality of care. So utilizing and integrating the social network theory, the Institute of Medicine's quality aims, and the Healthy People 2020 objectives, we're able to create this strong foundation for implementing and evaluating the effectiveness of a pressure injury prevention education program that's essentially designed to improve the nursing practice as well as improve patient outcomes. In conclusion, it's important to understand health behavior as it influenced by interactions between individuals and their social environments, as well as social support, social networks, coping mechanisms, and broader social factors such as race, class, and technology all have this very important role in shaping health outcomes. Understanding these influences can help researchers as well as healthcare professionals be able to more effectively design interventions to improve individual as well as population health. And I just want to thank everyone for taking the time to watch my presentation. All your feedback is going to be very valuable to me. Once again, thank you so much for watching.